Are you living with the relentless itch and swelling of chronic spontaneous urticaria, even with antihistamines? Imagine a life where your skin feels calmer, and those frustrating hives are significantly reduced. Today, we're diving deep into Rhapsido, a new prescription medicine designed to bring you that much-needed relief. Rhapsido, Remibrutinib, is a prescription tablet specifically for adults battling chronic spontaneous urticaria, CSU. It's for those who still experience symptoms despite taking H1 antihistamines. This medication offers a new approach to managing your condition. You take Rhapsido tablets twice daily, making it a consistent part of your routine. It belongs to a class of drugs called Bruton's tyrosine kinase inhibitors, or BTK. This means it works differently than traditional treatments. Rhapsido targets a specific pathway in your body. By blocking the activity of BTK, it helps inhibit the release of histamine and other inflammatory substances. This action aims to reduce the frequency and severity of your hives and swelling. Chronic spontaneous urticaria is a skin condition marked by hives and swelling that appear without an obvious trigger. These symptoms persist for 6 weeks or longer, significantly impacting daily life. Hives are itchy, raised, red or skin-colored lesions that can last for hours. Angioedema is a deeper swelling, often affecting areas like the eyes, lips, tongue, or extremities. CSU is rooted in immune system dysregulation, activated through allergic or autoimmune pathways. Mast cells and basophils play a key role, stimulating the BTK protein. This stimulation leads to the release of histamine and other inflammatory mediators. These substances are what cause the intense itching, hives, and swelling you experience. Understanding this process helps us see how Rhapsido can make a difference. Rhapsido works by precisely targeting and blocking the activity of a signaling protein called BTK. This protein is crucial in the cascade that leads to the release of histamine and other inflammatory mediators. By interrupting this process, Rhapsido helps to calm your immune response. Think of BTK as a switch that, when activated, triggers the release of inflammatory chemicals. Rhapsido acts like a lock on that switch, preventing it from turning on. This stops the overactivation at its source, reducing the frequency and severity of your symptoms. As a Bruton's tyrosine kinase inhibitor, BTK, Rhapsido offers a targeted therapy. It aims to reduce the underlying inflammation that causes your hives, itching, and swelling. This innovative mechanism provides a new pathway to relief for CSU patients. Clinical trials have shown promising results for Rhapsido. In studies like Remix 1 and Remix 2, patients taking Rhapsido experienced significant improvements in their itching and hive scores. This indicates a meaningful reduction in symptoms. Improvements in symptoms were observed as early as week 2 of treatment. By week 12, a notable 31.1% of Rhapsido patients achieved a complete absence of hives. This was measured by their weekly hive severity score, compared to only 10.5% in the placebo group. These results highlight Rhapsido's potential to provide substantial relief. It offers a chance for many to experience a life with fewer, or even no, hives. Discuss these findings with your doctor to see if Rhapsido is right for you. It's crucial to take Rhapsido exactly as your healthcare provider instructs. The standard dosage is 1 tablet, twice a day. Swallow the tablet whole with water, do not split, crush, or chew it. Rhapsido can be taken with or without food, offering flexibility in your daily routine. Do not change your dose or stop taking this medicine unless your healthcare provider tells you to. Consistency is key for effective treatment. If you happen to miss a dose, simply skip the missed tablet and take your next dose at its regular time. Do not take an extra tablet to compensate for the missed one. If you suspect an overdose, contact your healthcare provider or poison helpline immediately. Like all medications, Rhapsido can cause side effects. The most commonly reported side effects include nasal congestion, sore throat, and runny nose, nasopharyngitis. Other common effects are bleeding, headache, nausea, and abdominal pain. These are usually mild. However, Rhapsido may also cause serious side effects, including an increased risk of bleeding. Your healthcare provider will monitor you closely for any signs or symptoms of bleeding. If bleeding occurs, your treatment may need to be stopped. Your risk of bleeding might increase if you are also taking blood-thinning medicines. It's vital to tell your healthcare provider right away if you notice any signs of bleeding. These include unusual bruising, red or purple skin marks, pink or brown urine, or black, tar-like stools. Other serious signs include headache, dizziness, confusion, or feeling weak. This is not a complete list of all possible side effects. Always call your doctor for medical advice about any side effects you experience. You can also report side effects to the FDA. Before starting Rhapsido, discuss your full medical history with your healthcare provider. A significant warning is the increased risk of bleeding. Your doctor will monitor you, and treatment may be paused before and after surgery. Taking antithrombotic agents with Rhapsido can further elevate your bleeding risk. Always inform your doctor about all medications you are taking. Another crucial precaution involves vaccines. You should avoid receiving live or live attenuated vaccines while undergoing treatment with Rhapsido. Discuss any planned immunizations with your healthcare provider before starting this medicine. They can advise on the best timing for your vaccinations. Tell your doctor if you have had recent surgery or plan to have surgery. You may need to stop Rhapsido for 3 to 7 days before and after procedures. Also, inform them if you have bleeding problems, are taking blood thinners, or have liver problems. If you are pregnant or planning to become pregnant, it's essential to discuss this with your healthcare provider. It is not known if Rhapsido will harm an unborn baby. Your doctor can help you weigh the potential risks and benefits. If you become pregnant while on Rhapsido, consider enrolling in the Rhapsido Pregnancy Exposure Registry. This registry collects important information about the safety of the medicine during pregnancy. You or your healthcare provider can enroll by calling 1-888-669-6682. For breastfeeding mothers, it's not known if Rhapsido passes into breast milk. You and your healthcare provider should decide the best way to feed your baby while taking this medicine. This ensures both your health and your baby's well-being. Always provide your healthcare provider with a complete list of all medicines you take. This includes prescription and over-the-counter drugs, vitamins, and herbal supplements. Rhapsido can interact with other medications, affecting how they work or causing side effects. Avoid taking Rhapsido with strong or moderate CYP3A4 inhibitors or inducers. These can significantly alter Rhapsido's levels in your body. If you are taking PGP substrates, your doctor may monitor you more frequently for adverse reactions. As mentioned, combining Rhapsido with antithrombotic agents increases the risk of bleeding. Your doctor will carefully consider the risks and benefits of such combinations. This is not an exhaustive list of all possible drug interactions. Your healthcare provider is the best resource to review your specific medication regimen. They can ensure Rhapsido is safe and effective for you. Never hesitate to ask questions about potential interactions. Proper storage helps maintain Rhapsido's effectiveness. Store your Rhapsido tablets at room temperature, between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. Keep the medicine in its original container to protect it from moisture. The active ingredient in Rhapsido is Remibrutinib. The tablets also contain inactive ingredients such as copavidone, cross-garmalose sodium, mannitol, microcrystalline cellulose, sodium lauryl sulfate, and sodium stearyl fumarate. The tablet coating includes polyethylene glycol 4000, polyvinyl alcohol, red iron oxide, talc, titanium dioxide, and yellow iron oxide. Rhapsido offers a new hope for adults living with chronic spontaneous urticaria who haven't found sufficient relief with antihistamines. By targeting the root cause of inflammation, it aims to significantly reduce your hives, itching, and swelling. This could mean a calmer, more comfortable life. Don't let chronic hives control your life any longer. Talk to your healthcare provider today to see if Rhapsido is the right treatment option for you. Discuss your symptoms, medical history, and all current medications to make an informed decision. Take the first step towards finding the relief you deserve.